Welcome back to this podcast. We've had some truly insightful and educative episodes so far, all part of the Human Resource Management Visibility Month celebration here at the Ghana Health Service Western Region. If this is your first time listening, please do well to subscribe and hit that notification button. That way, you will be the first to know when we release new episodes. Now, today, we are asking, are you thinking about a move? Perhaps to a new district, a new region, or even a completely different health agency? It's a big decision, and the process can often seem complicated. Where do you start from? Who do you write to? And how long does it all take? If you've had these questions, this episode is for you. As part of our Human Resource Management Visibility Month, we are breaking down everything you need to know about postings and transfers. With that, we have here Miss Ruth Eshun, who is the Principal Human Resource Manager in charge of training and capacity building, as well as postings and transfers at the Western Regional Health Directorate. You are welcome, Miss Eshun.
Thank you.
Now, let's dive into postings and transfers. Tell us more.
It is very crucial for an esteemed staff of this directorate to understand the difference between postings and transfers so that the appropriate words will be used at the appropriate time. So I want to seize this opportunity to define the two. Posting is actually movement of staff from one station or facility to another within the Ghana Health Service, or placement of a newly recruited staff at their first station of work. However, transfer is the movement of staff from Ghana Health Service to other approved agency, such as CHAG institution, MOH, training schools, teaching hospitals, or University of Ghana Medical Center. So that is the difference between the two.
Thank you for the explanation. Let's dive deeper into this. You've mentioned postings and transfers, and it sounds like these aren't always the same thing. Could you start by breaking down the different types of postings available to staff within the Ghana Health Service?
For the internal postings, we have three distinct types. We can talk about inter-district postings. For example, I work at Jomoro Municipal Health Directorate, and I want to move from Jomoro Municipal Health Directorate to Secondary Takoradi Metro Health Directorate to join my spouse. That is called inter-district postings, a movement from one district to another. That is the inter-district. And then we can have intra-district postings. That is movement within the same BMC. I work in the STM, I work at Esikado Hospital, and I intend to move from Esikado Hospital to Takoradi Hospital. That is intra. It's within the same districts. However, inter-regional, that is movement from one region to the other. I'm currently working in the Western region. I intend to go to Central region to join my spouse, or based on some medical reasons. That is inter-regional.
Okay.
So that is for the trip.
That's a perfect breakdown. So let's take them one by one. So if a staff wants an intra-district posting or inter-district posting or inter-regional posting, what is the procedure?
All right. If you are a staff and you desire to move from one district to another district, or one district to other region, or one region to other agency outside Ghana Health Service, like I said earlier, Ghana Health Service, from Ghana Health Service to MOH institutions like the training schools, to CHAG institution, to teaching hospitals, or to University of Ghana Medical Center. The first thing you're supposed to do as a staff is to put in an application. And what you have to do at that point is to apply through your BMC head to the Regional Director of Health Service. So your application should be addressed to Regional Director of Health Service through your BMC head. Then you should ensure that in your application there are certain essential information about you that you're supposed to provide in the applications. The number of years you have served in wherever you are working, your name, your grade, your staff ID, your telephone number is also necessary, the number of years you have served in that district, and then the reason why you are seeking for the postings or the transfer. In this case, even if you have an evidence to buttress your reason, you can. For example, if you decide to move on medical grounds and you have a medical report to buttress that indeed you are not so well and you want to attend to your medical needs, then you can attach this medical certificate to the application, and then you submit it to the general administration or whoever is in charge at your BMC level for receiving of letters. That is where you have to drop your letter as a staff. It is also important to indicate where exactly you want to go. If you have the specific facility that you want to be posted to in mind, then it is very prudent that you indicate the facility and the district in which the facility is located. For instance, I work as Nzima East and I want to move from Nzima East to Sekondi Takoradi, that is inter-district postings. In my application, if I have any specific facility to be posted, then I have to indicate that facility in the application letter. That informs decision making at the regional level. So in this case, I will have to indicate in my application letter that I, Ruth Eshun, who intend to move from Nzima East District Head Directorate to Sekondi Takoradi, specifically a Sikado hospital, to join my husband. In that case, it's informed decision making at the regional level. If you want to go outside the region, maybe to central region, and then you also know where exactly you know that the husband is situated in the central region, then we are also saying that indicates that in the letter that I will want to move from western region to central region, specifically a Rim government hospital. In that case, when we are sending our letter of inquiries to Cape Coast Regional Head Directorate, we'll be able to inquire from them whether they have a vacancy at this specific facility to absorb you. So it is very important to indicate the facilities in your letter.
So let me ask you this. You said as part of the internal regional posting procedures, there is what is known as letter of inquiry to inquire about vacancies at the preferred region that the staff wants to go. So what if the region writes back and tell you that they do not have any vacancy for such staff coming to their region? What happens?
Thank you. Such region will always have an alternative for the staff. So in most cases, they will indicate in their letter that you requested for a vacancy for an enrolled nurse working in Western region to join my region in maybe KEA district in Central region. However, I don't have vacancy at KEA district. I have vacancy at rather Ewutu Senya district. So kindly relay the information to your staff. If she is willing to accept posting to Ewutu Senya, should you post or release her to us? So when we get such information with such condition, we also forward the same or relay the same to our staff, and sometimes even push them to accept to the condition that has been stated in the letter. So an acceptance letter is even written on such a staff to indicate his willingness to accept posting to where the region has actually indicated there is a vacancy.
So this would be my last question and we will wrap up. So for instance, I am working with CHAG and I want to come to the Ghana Health Service. What should I do? What is the procedure?
That is transfer, as I indicated earlier. And unlike inter-regional posting, which is authorized by the Regional Director of Health Service, the transfer is, however, authorized by Director General. So if you are a staff and you are working in the CHAG institution and you intend to come to Ghana Health Service, it's just the same procedure. You will write an application to Director General Ghana Health Service through your CHAG secretariat, through your BMC you are working with. Then you tender in such an application to your immediate supervisor for onward submission to Director General to the secretariat. A letter of inquiry from Director General will be written to us at the Western region here, Ghana Air Service, on your behalf, requesting for vacancy for you in the Ghana Air Service or otherwise. Then we also give them feedback for the processes to continue. So it's just the same like inter-regional.
Thank you very much, Miss Eshun, for all this information on postings and transfers. I have learned a lot, and I believe you have also learned a lot from this podcast. We have talked about the difference between postings and transfers. We have looked at the types of internal postings, looking at intra-district, inter-district, and then inter-regional postings. And then we've looked at the documents that you need, the procedures, and even how to craft your letter when you are seeking for postings. It is very important for us to always follow the official administrative channel so that your application will be properly routed to be processed. Thank you for listening, and we will meet right here again on our subsequent episodes. This has been insightful. This has been educative. Thank you for listening.